It is my pleasure to introduce today our dignitary speaker, Deputy Commissioner Kaylee McGuire. Kaylee McGuire is Deputy Commissioner for Aging and Disability Services, overseeing the Division of Aging Services, the Division of Disability Services, and the Division of Developmental Disabilities at the New Jersey Department of Human Services. In addition to serving as Governor Murphy's health policy advisor during the COVID pandemic and working as a health policy advisor for the State General Assembly's Majority Office, McGuire is a recreational therapist by background. She has more than a decade of direct care experience providing recreational therapy and child life services in a variety of settings, including medical daycare and long-term care. Personal caregiving experiences with aging family members and a career dedicated to serving people with disabilities and complex medical needs led her to public service. She holds an MBA from Rutgers, is a New Jersey native, and a loving aunt of 6. So Deputy Commissioner, welcome to InnovAGING NJ. We are thrilled to have you here with us today, and we welcome you to share your remarks at this point.
Morning. Thank you, Natalie. Good morning, everyone, and thank you to Dr. Greenfield and the entire team at Rutgers School of Social Work's Hub for Aging Collaboration. Gathering so many people and organizations together in one place is no easy task, even online. So I'm really grateful for the opportunity to speak with everyone in this diverse and very enthusiastic group. As I looked at today's presenters and all the attendees here today, it was really great to see names and projects that we at Human Services are very familiar with, and also some new groups I haven't had the chance to meet yet. And that's the point of days like today. It takes all of us to create a New Jersey that we want for ourselves, for our families, and for all older adults. The Division of Aging Services within our department is a connector of sorts. The division director, our assistant commissioner, Louise Rush, says that her team serves every person Human Services touches. If not now, then someday eventually. And I really appreciate her perspective because it reminds us that we can't just flip a switch and say, okay, now this is an older adult issue. We really need to think of aging as a continuum rather than a category. And we need policies that support individuals at all stages of life. And I'm really excited to be here talking to all of you, whom I feel, we share that focus and that vision. So I wanted to talk a little bit about our upcoming budget for the fiscal year 2025 that Governor Murphy just announced recently. And I know a lot of us instantly thought of kids and working parents when Governor Murphy's recent budget address was themed Making New Jersey the Best Place to Raise a Family. Though many of the policies he proposes funding do go towards helping older adults within family units thrive. So growing enrollment in our Senior Gold and PAD prescription assistance programs is a critical investment in the older adults of New Jersey. Our Human Services budget for FY25, which begins July 1, includes $12 million in additional funding to support the continued enrollment growth in Senior Gold and PAD that we're expecting due to new paid advertising, promotions in pharmacies, since pharmacies are now mandated by law to promote the program at point of sale, and our new Senior Save Navigator grant program we are launching this year. I'm also excited to share that the Division of Aging Services will receive an additional $1 million in funding to support county area agencies on aging, or AAAs. As referrals to our managed long-term services and supports program grow, we're relying on our AAAs more and more. So this funding will help manage increased volume and ensure that individuals are first screened by AAAs so they can be connected to appropriate services sooner, which makes a big difference in building, so they can be enrolled sooner in services while they wait for Medicaid determination and be connected to services right at the county level. And there are other investments that might not seem targeted to older adults in the governor's budget proposal, but it will make a tremendous difference in building an age-friendly state. So the budget includes things like modernizing the state's energy grid and greater support for NJ Transit, powering connected communities for all New Jerseyans. The FY25 budget also maintains the $95 minimum a month SNAP benefit and will transition the funding into chip cards to improve security and prevent fraud and skimming. The governor's budget also continues funding human services work on ending the opioid crisis by providing more services in community settings and expanding the nursing and behavioral health workforces benefiting all residents. Governor Murphy even expressed his support for expanding accessory dwelling units in his budget speech as part of his affordable housing initiatives, leveraging our strengths and sparking innovative ideas to push New Jersey toward a modern, age-friendly society. And that will take leadership and innovation, and we have an abundance of both reflected by all of you here right now. At Human Services, we are so grateful for all of our wonderful partners, past, present, and future, and sharing their wisdom here today. I hope everyone enjoys the convening and takes actionable items and inspiration back to your communities. I look forward to partnering with you all now and in the future. Thank you so much.
Thank you, Deputy Commissioner McGuire. We appreciate your time with us and your thoughtful and motivating comments about the importance of our shared work here together and the overview of this work going on at the state level. So thank you so much for your time today. We appreciate it.